Hi everyone, and welcome to the Inside Health, the place where we try to demystify some medical and healthcare issues and try to explain them in a very simple, clear and honest way. My name is Duke Otieno, and today we shall be talking about a drug that many people use, some people misuse it, and many other people don't fully understand the drug. And your guess is as good as mine. Today's topic, we're going to talk about the e-pill. Yes, the e-pill. So please note that this video is judgment-free and more of an educational conversation. So no shaming, no fear-mongering, but just trying to talk facts that are there around the e-pill. So whether you've used it before, whether you know someone who has used it before, or you're just curious to know more about it, then this video is for you. So what is the e-pill? E-pill simply means an emergency contraceptive pill. That is what the E means in the e-pill. E is for emergency. So inside the pill, there's a drug called the levogestrel, which is a synthetic hormone. When I talk about a synthetic hormone, it is a laboratory created version of a hormone that the body produces. So the body produces a hormone called progesterone. So the laboratory version is what we call levogestrel. So it mimics the action of this hormone, which is usually produced by the body, that is called progesterone. So what does this progesterone do in relation to the context of contraceptives? So the body produces progesterone, and progesterone generally prevents ovulation, and also it causes the thickening of the cervical mucus to block sperms, and also it thins the uterine lining to prevent implantation. So the word emergency in the name simply means the drug has to be used after unprotected sex and not before. So it is important to know that e-pill is designed to prevent pregnancy after a contraceptive failure, things like a condom burst. So it reduces the chance of pregnancy if taken within a specific time period, that is 72 hours, which is equivalent to 3 days. So please note that e-pill is not a daily contraceptive. It is not a routine method of preventing pregnancy, and it is not meant for frequent use. Very important to note the 3 points. So when should e-pill be used? E-pill is only meant for specific situations, things like sex without a contraception, in cases of condom breakage or slippage, in cases of missed oral contraceptive pill, or in those cases of sexual assault like rape. So it's important to note that it should be taken as soon as possible, since its effectiveness usually decreases with time. So ideally it should be taken within 72 hours, that is 3 days, after unprotected sex. Although the earlier you take the e-pill, the better, since the effectiveness decreases with time. So how does e-pill work? This is important. It's a very important area to talk about, since just understanding how it works is able to make you make a more informed decision before using e-pill. So it works generally by delaying or preventing ovulation. For that, what I mean is the release of an egg, which occurs once a month but takes 3 days. So it prevents that process of release of the egg, which is called the ovulation. This makes it hard for the sperm to meet the egg for fertilization to occur. So it's important to understand that e-pills do not terminate existing pregnancy, and e-pills do not cause abortion, and finally, it does not cause any harm to the fetus if pregnancy has already occurred. Once implantation has happened, e-pill will not work. Yes. So what are some of the common myths about e-pill? For the purpose of clearing the confusion and myths around e-pills, I will try to explain on some of the very common myths that surround e-pill. we have the first myth that people think e-pill is an abortion pill, which is false. E-pill works before pregnancy begins, not after. It can only be considered as an abortion pill if it was working after pregnancy has occurred, but that is not the case. Instead, e-pill works before pregnancy begins, so e-pill is not an abortion pill. We also have that myth that you can take it every time you have sex. That is very wrong. It is called e-pill for a reason. It is emergency contraception for a reason. That means it should not be used every time. Your every time cannot be an emergency. When it's every time, that is no longer an emergency. Yes, so it cannot be used every time you have sex. You also have that myth that the more you take it, the better it works. Again, for this one, no. More pills don't mean more protection, but instead it only means more side effects. So it's important to stick on the dosage of the e-pill as directed by your healthcare provider. So you taking many pills more than recommended does not mean that it will work better. No, you'll just have more caused by the pill. And the last myth is around infertility. Some people say that e-pill can cause infertility. My response to that is that there is no scientific evidence that e-pill can cause any form of permanent infertility. Actually, studies have shown that some people who have used e-pill were still able to get pregnant. So its effect is more temporal and can only cause things like menstrual cycle changes, but it does not cause any form of permanent infertility. Yes, now we try to talk about the aspect of misuse and abuse, and this is where the problem starts. There's a lot of misuse of e-pill, more so because of the limited information among the people or wrong information surrounding the e-pill. Some common misuse of e-pill include things like taking e-pill multiple times in a month, using it as a main contraceptive, taking it days or weeks after sex, combining multiple brands of the e-pill thinking you'll get better effect, or taking it without understanding the timings for the e-pill. This frequent misuse is quite common and definitely can lead to things like hormonal imbalances, irregular menstrual cycles, things like unexpected bleeding and spotting, delayed or missed periods, and the aspect about anxiety and panic about pregnancy since the periods may delay. Yeah. So what are some of the side effects to expect when using e-pills? Most people do tolerate e-pills quite well, but we have some mild side effects, and it includes things like nausea and vomiting, dizziness, fatigue, breast tenderness. When I say breast tenderness, I mean the sensitivity around the nipple area, things like headache, spotting, or irregular bleeding, and also changes in the next period timing. So it's important to note that some people might experience vomiting, and if this happens within 2 hours of taking the e-pill, it may reduce effectiveness, and therefore medical advice should be sought in that case from your healthcare provider. Please note that if the vomiting occurs within 2 hours of taking the pill, this might reduce the effectiveness of the e-pill, and therefore please go and seek medical advice from your healthcare provider, so that we don't end up saying that the e-pill backfired. No. So an important thing to note is that e-pill don't protect anyone against the sexually transmitted infection. When I talk about sexually transmitted infection, these include things like HIV, things like gonorrhea, chlamydia, and syphilis, and only barrier methods like condoms, both male and female, are able to provide the STI protection. So very important to note that e-pill is only meant, there is a certain group of people who should be extra cautious when using e-pills. And definitely these are women who have frequent menstrual irregularities, those who have certain hormonal conditions, and those ones who are who experience repeated contraceptive failures. So if you find yourself or know someone who takes e-pills more than twice a month, then that is a signal that they need a more reliable long-term contraceptive method. If you're such a person, this is not a failure. It's just a chance for you to choose a better contraceptive for you. And when I talk about better contraceptive, for the purpose of those who may need e-pills more frequently, then there is a variety of better choices that you may consider. Things like the daily oral contraceptives, the injectable contraceptives, we have the implants, we have the IUDs, and we have the condoms. For these choices that I call better choices, they are more effective and they are safer in the long term, and they also reduce that aspect of anxiety after after that repeated hormone exposure. You can always talk to your healthcare professional or healthcare provider so that they can help you choose what fits you best amongst those options that I just mentioned there. We also have that aspect of psychological and social aspects around P2. Looking at the social and psychological aspect, the e-pill, many people use e-pill when they're in panic mode. Usually their minds is full of things like fear, pressure, misinformation, and stigma, which of course they do play a role in their psychological and social well-being. So when we empower people with information on such very sensitive topics, it really helps them to reduce anxiety. It helps them, they feel empowered, and they'll be able to make responsible choices, and also to encourage an open conversation about reproductive health. So it's important to know that knowledge is not just an encouragement, but instead it's more of empowerment. Yes, so to wrap this up, this conversation, we just need to know that e-pill is a very useful emergency tool which is safe when used correctly and occasionally, and should not be used as a routine contraceptive, and it does not substitute for a proper sexual health planning. This has been the Inside Health. Thank you for watching, and if you found this helpful, please like the video, leave a comment, and subscribe to the channel to help us reach more and more people. I've been your host, Duke Otieno. See you in the next one. Bye bye.